this is really our attempts to translate these precision medicine or endotype concepts to the clinic at scale. And so we've been working on this for 5 or more years now. We're quite excited about it. So this is the next addition in really, at the moment, our ability to measure these endotypes in a gold standard sense is very involved. We need a very a very comprehensive laboratory where we can carefully measure the EMG and upper airway collapsibility and so forth, which is impractical for clinical purposes. So what this machine learning model allows us to now do is take standard inputs from a sleep study and clinical information that we already collect during our sleep studies, input that into these physiological-based model and make some predictions about who's going to respond to various treatments. So we've shown that we can estimate each of the endotypes using this approach just with 8 to 10 standard PSG inputs plus age and BMI. And now we've also shown that in terms of oral appliances or mandibular advancement splints, we can predict in the order of about 80% certainty who's going to respond to these devices rather than the current clinical practice, which is about 50%. And so what we've done in this particular application is look at the removal of the adenoids and tonsils for children, which is the first line therapy. Again, it's very hard, it's a very big clinical challenge, which children are going to respond to this treatment and which are not. So we've applied our physiology-based model to this situation, and again, we've shown very high rates of prediction in the order of 80%, depending on the definition. If we use this standard information, we can get a much better idea, using the physiology, using the data that we're already collecting to give us insight who's going to respond to this treatment and who's not, so that we can better direct our treatment decisions. So this is the first step. We need to go on and test that prospectively and larger cohorts, but these exciting data suggest that this may be a viable approach forward.